Hi, good morning, Dr. Biswarup, Cardiothoracic and Heart Lung Transplant Surgeon in Artemis Hospital. So today, it's how the day of cardiothoracic surgeon is. We are starting off with a complex coronary artery bypass grafting. We're planning to do total arterial Lima-Rima Y-Graft on this gentleman, Mr. Omar, who's a 51-year-old guy who's come to us from Iraq. And as we start the day, the first thing that I do is I come to my office, do my paperwork, and then for one final time I sit down and have a look at their angiograms. This is basically the map of your heart which shows the blockages in your arteries, and it is one of the most important thing for any cardiothoracic surgeon to review before you are going to the surgery. So before we go to the surgery, for one final time, I make it a point to look at the coronary angiogram, have an absolute idea of the graft that I am going to use, probably make a small screenshot out of it and print it out on a piece of paper, and that keeps your moorings very straight for doing the surgery. Thanks. So we're going to the operating room now, and we'll probably start operating maybe in the next 15 minutes. There's a 51-year-old gentleman who needs a triple vessel bypass. We're planning to do a Lima-Rima Y total arterial grafting. So let's walk down to the OR. Hi, so coronary artery bypass grafting, timeout. Triple vessel is this 51-year-old guy, identity confirmed, Omar Muhammad. Imaging's on display, expected blood loss is 500 mils. We're thinking of doing a Lima-Rima Y 3 grafter, Lima to LAD, Rima Y to OM1, and probably a smallish PDA. The team may introduce Dr. Samir Taneja in anesthesia, myself Dr. Biswarup, cardiothoracic surgeon, Mahipal is my scrub nurse and assistant, Ishwar is another first scrub, Ayush on perfusion, Abhishek is an anesthesia technician, and Mohsin is on the floor, circulating. All sutures ready, cautery on fire, 100, let's do it. Hi, so this is the grand old view of cardiac surgery. As you open somebody's chest, you can see the heart is beating, you can see the lungs climbing up from either side. This is the standard old-fashioned sternotomy. Can I get a clip please? Which is used to open the hearts for all the old school open heart surgery. This is the heart. This is the left internal mammary artery. We'll soon make a Y-graft with this one. So we have so far harvested both the left and the right mammaries, and in a Lima-Rima Y or a total arterial bypass grafting, this is called the master anastomosis, which is the Y graft. So we're now creating the Y graft, and then we'll do the 3 bypass grafts on the heart. Yeah, so we're doing the final graft with the Y-Graft with the Rima. So we would take another maybe about 10 minutes. Mahipal, can you just follow it? Yeah, thank you so much. And we should be done with the
On
grafting.
please.
So this is total arterial CABG. Probably this is my most favorite surgery. So this is an artery for an artery. This is the left internal mammary going to the LAD, forming a Y with the Rima going to one of the OM branches. Here you can see, and it is following to the PDA. Hi, so we finished the case. It will take about half an hour of post-surgical anesthesia, recovery, dressing, draping. The patient will then get shifted to the ICU. Will stay overnight on a ventilator. And tomorrow morning he should be back doing his normal thing, sitting on a chair, taking his first steps. So, thank you so much.